Sugar industry paid scientists in the 1960s to play down the link between sugar and heart disease and promoted saturated fat as the culprit instead. February budget, the Finance Minister Pravin Gordhan, in a one-liner, include in his list of tax proposals the introduction of a tax on sugar-sweetened beverages, which he said would come into effect from the 1st of April next year, that's 2017. Naturally, a storm has ensued in the wake of that policy paper. The carbonated beverages industry in particular, which is represented, has argued the tax will cause the loss of thousands of jobs in the industry itself, in manufacturing, but also downstream in retail, in spas and shops and so on. The South African Institute of Race Relations, which said, the sugar tax, and I quote, is a revenue grab that will have zero health benefit to South Africa and may worsen socio-economic circumstances.
How can we use the fiscal instrument to start to look at compensation for the external cost and also looking at the issues around the change of behavior with excise taxes?
So our research has found that at least 250,000 South Africans will be prevented from becoming obese. That is not a small number. South Africans currently are in the top 10 consumers of sugary sweetened drinks. These sugary sweetened drinks, on average, have 8 to 9 teaspoons of sugar in them each. There is strong evidence from other countries and other jurisdictions in the world that these taxes do actually work, and it takes a while for that to happen. It predominantly will affect younger people in South Africa. Drinking just one sugary sweetened beverage a day increases the chances of obesity in children by 55% and in adults by 27%. The tax is one of several measures. It is the most effective, but it is not the only measure that needs to be taken to address obesity. The next most effective intervention is marketing to children, something that continues to go on in South Africa, despite a quote-unquote voluntary pledge by the beverage industry not to market to children. 50% of Soweto's schools contain advertisements for sugary beverages. The beverage industry has specifically and publicly said they are targeting the lowest socioeconomic groups in South Africa. These are the people who can least afford to be obese. The health systems cannot cope, they cannot cope, and a poverty cycle is induced. These sugary beverages are liquid sugar, affect the body very differently because of the way they're absorbed.
If you look at the McKinsey report on obesity, it speaks to other effective methods of addressing obesity, having reformulations in our portfolio of products where we're doing sugar reductions. We're looking at providing consumers with smaller package sizes.
We think that the level of the tax should, if that's the route to go, probably be more in the region of 3 to 7%, not anywhere close to the 20%. We need to really understand what would the impact be on the industry. I know one of the counter arguments is often, yes, but people will switch to other types of beverages that could replace that revenue. We've seen some very interesting trends in Mexico, for example. Yes, people did switch their consumption away from sugar-sweetened beverages. But one of the things that for every 10 people, almost 4.5 moved to pure sugar. From an economic standpoint, if you're looking at a tax and you have to decide the level of that tax, then surely there should be some analysis behind where you want to actually target that tax and why it will be effective at a particular rate.
If you look at this industry, it's a very healthy, thriving industry. And I think employment from this industry has outpaced the economy, growing at about 5%. The effectiveness of tax as a measure to control or to drive behaviors in terms of obesity. The McKinsey Global Institute did a study. They looked at about 15 to 16 interventions. And tax as an effectiveness tool, I think, came in second last.
If it's healthy because it's externalizing costs, that is, if it's healthy because other people who are buying the products are getting sick and somebody else is paying the cost for that, then it doesn't matter how fast it's growing. And I think that's a core problem here. And I think it's particularly a problem in South Africa because so many of those who are ill go to the public sector. So the cost is borne by everybody. There have been studies that show that one of the things that pushes poor households into destitution is when somebody gets ill. When you tax a good and you want to say what's the impact on the economy as a whole, there's two questions. One is, can people find substitutes? And is the good a necessity? In this case, consumers can buy other goods and services fairly easily. Nobody really needs to buy fizzy drinks. Less than 5,000 direct jobs would be lost. All the rest are in terms of the impact on the spaza shops. Now, it's very hard to say what's the impact on spaza shops. By their own data, they're saying 30% of turnover, but only 17% of profit because these are goods, because they're luxuries. We should be looking for win-win solutions and not saying you have to accept the cost to the health of South Africans because we think otherwise we'll be in trouble.
There are 200 people a month losing their limbs to diabetes. There are endless and countless strokes. People are going into renal failure. There are 800 cases of blindness from diabetes alone every month. These are not trivial. They're costing, the externalities are costing South Africa a huge amount.
I don't think anybody in this room, I hope, thinks that people will continue to buy sugary drinks if the price goes up. Nobody's debating that. I think the debate is what will they buy instead. I do think there's a problem of saying the perfect becomes the enemy of the good. You see what I mean? That then let's deal with that if they start eating other things, if they do in fact shift to donuts. But the fact is this is one of the highest sugar, easily accessible things that's available. Of course we should have the comprehensive program, but if we're going to wait for everything we do till we have the comprehensive program, then we will likely never do anything.
The challenge in South Africa that we sit with is that the taxes that are least disruptive to the economy in terms of their potential impact are not always the ones that's the most palatable.
If this isn't about revenue, then let's all just impose a 20-30% cut, mandatory cut on sugar and all beverages, and we can all go home.
Would it be less discriminatory? From an economic standpoint, probably yes, because you will in that way catch the culprit then. Sugar is something that's potentially addictive. Unfortunately, you see that very often you don't get to the people that have the real issue with this through a tax because of the elasticity of demand.
The tobacco tax has been extremely effective. Since 1994, when the government first increased the tax till 2012, there has been a 40% decline in the prevalence of tobacco use, not consumption. The numbers of people who say they smoke has declined, and more importantly, it's been highly effective amongst poorer people. In 1998, when the government was talking about banning tobacco advertising, increasing taxes, we heard the very same arguments. The newspapers were saying newspapers would close down because they'd lose tobacco advertising. Sports bodies were saying they would all go bankrupt. Everywhere you looked, the economy was going to end. The only thing that government should have done in addition is used some of the tobacco tax revenue for health promotion.
If you do not educate the mother of the unborn child not to develop the sugar taste bud, okay, that first teaspoon of brown sugar that the great-grandmother says, oh, your baby's constipated, put brown sugar in the bottle.
We have engaged with the Department of Health to start looking at, those other programs, because those programs will be your non-tax interventions, be it around advertising, be around education, all of those things. To say, come up with programs that will be able to measure the impacts, and that money will be made available.
I do think that part of the problem when you look at the benefits is you have to look at the benefits over more than 2 years. I mean, the whole point of this is that if it reduces obesity, particularly starting with young people, you're looking at 50 or 60 years benefits, and you'd have to sum that up. And from that standpoint, the economy will certainly adjust. If we just look at the cost to the industry, we ignore the adjustment in the economy, and we ignore the cost of externalities, then of course you can't justify it. But if we want to have a balanced view, and by the way, that's what SEAS is about, the kind of impact assessment you say you want is specifically about saying you need to look at costs and benefits also to different stakeholders. You can't have policy discussions based on just the impact on one group's interest. You have to look at the impact on society as a whole.
With regard to the nanny state, that is an old chestnut that's been raised by alcohol, tobacco, and the Free Market Foundation. So there is actually a choice. No one is stopping anybody from drinking a sugary drink, but if they do so, there is a cost to society and they should pay for it. Actually having a tax is an education in itself. It's a very strong public health message.